Our next speaker in the Dream Bigger panel is, in fact, Stephen Elliott-Buckley. Stephen is a political scientist and a researcher with CUPE and the Hospital Employees Union in BC. He will focus his attention on the importance of accessible and high-quality long-term care. Thank you, Steve.
Thanks very much. It's great to be back in Edmonton on Treaty 6 land. It's wonderful to be invited here to help turn everybody into being a Medicare expansion ally into a co-conspirator, which means way more action compared to anything that anyone's done in the past. This whole thing about getting Medicare and then fighting to keep it, this is what we're going to deal with the rest of our lives. Let's not be complacent about that. I have three things to talk about. Very briefly, I'd like to talk about Medicare principles and the 1984 Canada Health Act legislation that we're under now. But legislation is boring, so I won't spend too much time on it. Mostly, I want to talk about process. And sitting here yesterday afternoon thinking about community and relationships and reconciliation and member engagement, all those themes really fit into the whole idea about process and what it means to be a co-conspirator to build healthcare and Medicare into something we truly deserve as a nation. And finally, I'd like to talk about a national continuing care program that CUPE has been working on since 2010 and has been derailed a little bit from the end of the Health Accord several years ago. So in 1984, the Canada Health Act became our new legislation covering Medicare, which started in the 1960s. I want to talk about universality and portability. Universality means universal access. Everybody gets access to the best quality healthcare system we can possibly get, whether you're rich or poor. Even rich people deserve great healthcare. And a lot of times they just think they're entitled to it, but they do deserve it too. Portability means that when I turn 65, I do not want to send a Freedom of Information request to every province in this country trying to figure out what their long-term care staffing levels are to figure out whether or not I can retire in BC or if I have to move to Somerset PEI, and which would be fine because who wouldn't want to retire in Somerset, but I don't know what the staffing levels are across the country, and that's really sad. That kind of information is known, it's just not publicly available. So those two principles are really important when thinking about seniors' care. When Medicare started, the whole idea was that the federal government would cough up 50% of the funding for Medicare, medically necessary things in our society. And starting almost immediately, they dropped below 50%, down to about 1/3. And that's the pathetic figures from the last 40-odd, 50 years from the Parliamentary Budget Office. And the biggest dip in the bottom, 1998, 1999, was right after the Paul Martin cuts from the 1990s. And it's recovered a bit since then, but it hasn't come up terribly high, and it's certainly nowhere near the 50% we need. And frankly, if you can pull off a 50-50 draw yesterday as easily as that, it's not that hard for the federal government to cough up 50% of medical costs. They just don't want to do it. And e-petitions are really important, but they're just the start. You know, the one thing that actually motivates a politician to do something that you want them to do you know what it is? The threat of unemployment. You have to instill in them a fear for their very jobs that they will lose their seat if they do not do this thing that's critically important for you. So e-petitions are a start, but they're also a tool to mobilize people to come out of a place of like, yes, I like Medicare too, like, okay, what are you gonna do to fight for it? Because people are trying to peel it back on all of us. And other threats to Medicare include things beyond just the federal government not funding their share of it. Even though there's been hundreds of threats to Medicare just in the last 10 or 15 years, in BC, just in recent weeks, while we have an election campaign going on, Health Minister Terry Lake admitted in an interview with the Globe and Mail that they've been secretly negotiating ways of moving private one-day clinics to 3-day overnight stays, which creates private for-profit hospitals, which is the end of Medicare. Okay, that can't happen. We knew, sort of suspected they were doing it, and he finally just admitted it, so the secret's out. I love it when politicians, are retiring and they can say whatever they want. Linda Reimer, a Liberal MLA in BC, also was asked at an all-candidates meeting, do you favor privatizing healthcare? And she's like, yeah, I think we should privatize parts of healthcare. Not that they haven't been doing that for 16 years, but she actually admitted to doing it, and then bragged about getting a private clinic procedure, and then had this beautiful phrase where she said, I'd like to believe that it freed up space for somebody in the public system. And she was very careful to say that because the evidence indicates that that's not what happens. No. Free space does not get freed up like that. And May 9th, in just several days, is the next BC election. And this is my time to ask you to phone all of your friends and family in British Columbia and ask them to vote for the NDP and get rid of this disgusting Liberal government. So I would strongly appreciate that. So what we've seen in terms of process in the federal and provincial government is what leadership doesn't look like. Under Harper, the Health Accord was scuttled with a unilateral declaration that instead of a 6% funding increase or escalator per year, the feds were only going to cough up 3% or higher if the GDP happens to be higher. They also had less national tracking of health outcomes. They cut that when the Health Accord expired in 2014. And they moved to a per capita funding model, so every province and territory gets the same amount of money per capita, regardless of whether their demographics vary significantly. So Trudeau came in and campaigned on having a new relationship with provincial and territorial governments, and he lied. He started a new health accord discussion with politically weak provinces in the Atlantic and Maritimes that were all red seats in the federal election, and he forced a really crappy health accord on them and then started going after one province at a time to get everyone else to sign on to it. The divide and conquer tactic was not nice. People didn't like it, and there was no way to build a nation with everybody sitting at the table when you have those kind of sneaky tactics, very Harper-like tactics. And also, he came up with the same crappy 3% funding escalator, or depending on GDP if it's higher. So this brings me back to Treaty 6 land. This broken relationship between the federal government and the provinces and territories is not a new thing. We've seen it for generations with Canada's relationships with First Nations. This is a map of British Columbia, as far as I can tell, the most accurate map, because if you didn't know, more than 90% of British Columbia is not unceded territory. There are no treaties in BC from virtually all of the province. And these are the people who actually have lived in BC for a very long time. And I live in East Vancouver, which is in the very bottom center of the map, in Coast Salish territory, the land of the Squamish, Musqueam, and Tsleil-Waututh people. And also 20 minutes from Burnaby North Secondary School, where Ryan Nugent Hopkins went to high school, which is also Tsleil-Waututh land. So I expect a lot more credibility for the rest of my talk from that. So after as the health accord was moving towards expiring in 2014, CUPE health researchers around the country in 2010 started working on a campaign to figure out what to do when 2014 happens. And the first thing to do was renew the health accord to make sure the 6% funding escalator continues, to get the feds actually committing the amount of money that they're supposed to, as well as improving the data tracking that was going on in the health accord, and Harper killed that, but also to expand Medicare. And that was a really noble concept because no one's been able to do that in the last 45 years before that. So we worked with the Council of Canadians and the Canadian Health Coalition, the Friends of Medicare, and all the other health coalitions across the country to build a campaign to talk about eyes and teeth and hearing and mental health and seniors care and drugs. These are things that should have been part of Medicare, hadn't been, and now is our time to do that in order to make the future worth fighting for, worth living in. So what does a good relationship look like? Well, the federal government's role is to be a national leader, not to dictate what happens with healthcare, because constitutionally they're not allowed to, but to convene space so that the feds and the provincial and territorial governments can sit down and actually discuss what it means to run a healthcare system. They aren't federal meetings, they're national meetings. And that hasn't happened with Trudeau, which is very sad. Also, becoming an actual 50-50 funding partner so provinces and territories can expect money to come and not just whimsical money that gets tossed their way. As well, to develop and track national standards and make sure funding is allocated properly. And so CUPE has been working on a national continuing care program with several features. The whole continuum matters, everything from home support to home care, independent and assisted living, residential and long-term care, as well as hospice, palliative, and end-of-life care. The whole process matters. And Trudeau has recently sent us $3 billion for home care and mental health over 4 years, which is $750 million a year, which is not enough, not even remotely. And it's whimsical money. I don't want whimsical money. I want commitments from the federal government that we can rely on a 10 to 20 year budget tracking process. And we haven't got that right now. The health accord escalator, we want to get that back up to 6%. That was scuttled in 2014 when the health accord ended, but Harper was crafty and he made sure the 6% didn't expire until 2016 after the federal election, but he lost anyway. And frankly, this whole GDP thing is really nonsense. Healthcare is a human right, right? I do not think healthcare increases in funding should be dependent on the global economic system and how it treats Canada's GDP. Healthcare is not a bonus that happens when the economy is good. This is a core thing that we need to be funding regardless of what happens in the world's economy. So also we need minimum national staffing levels, either a ratio like we have in childcare in British Columbia or some kind of hours per resident per day formula. And we need to sunset and contract in private delivery of seniors care, period. Just, because it's the thing to do. Consistency matters. We need national standards in healthcare outcome tracking, targeted national funding, get rid of the user fees or per diems. In BC, people pay $1,000 to $3,000 a month for residential care based on their income. We need to have enough beds for our seniors population. So no more bed blockers in hospitals and people stuck at home. We're tired of this, and we can fix it. And frankly, caregiver burnout at home is a monstrous underreported problem, and it's also a feminist lens issue problem, which is easy to ignore because feminist issues are easy to ignore in Canadian politics. We need to end that. And also health outcomes matter because long-form census, do you remember that? If we don't measure it, we don't know what's going on. And transparency matters as well. Facility funding costs and health outcomes are transparent if they're publicly run. And currently, in the privatized system, we have serious problems that a public delivery can actually fix. We have secret contracts and contractors, finances and profits, and now foreign ownership coming in, and bang, a multi-billion-dollar Chinese insurance company bought 20 retirement concepts, long-term care homes in BC recently for $1 billion. I'm still trying to figure out how the math works. We also need to get rid of the contract flipping and care staff instability and lower staffing and care levels that exist in for-profit sites. We need to get rid of that as well. So it's time to keep moving forward and to not be complacent. And I'd like to finish off with one quote from Terry Fox. I was just in Victoria at the QBBC convention for the last week, and the Terry Fox exhibit is at the museum there. It was fantastic to see. And one of his quotes really resonated with me for this whole expansion of Medicare plan. Even if I don't finish, we need others to continue. It's got to keep going. Same thing for Terry Fox, same thing for expanding Medicare. Thank you.
Thank you.